Controlling serious bleeding. Serious bleeding can be life-threatening and very distressing for the patient, even for the first aider. When dealing with bleeding, remain calm and remember your training. In many cases, it will look a lot worse than it actually is. But with all types of bleeding, as with other first aid, we must make sure that we have our gloves on. The first part of controlling serious bleeding is the use of direct pressure. This can be by the patient themselves applying pressure over the wound or using your gloved hand. This stops some of the blood from leaving the body and also assists the clotting process. Cuts can also be treated by using a standard pressure bandage or dressing. Pressure dressings are wrapped in plastic and sterile. You should check the expiry date. After this date, the dressing is no longer acceptable and is no longer guaranteed to be sterile. When you check your first aid kit, you should make sure that any expired dressings are disposed of and replaced. Now, when you open a pressure dressing, you will notice that it is a bandage with a pad. The bandage is much shorter on one end. The pad is applied directly over the wound and the bandage wrapped around the limb to keep the pad in place, as demonstrated here. It is important to mention that if there's an embedded object in the wound, do not remove this. In cases of an amputation, sometimes there may not be a lot of blood, as the blood vessels can be drawn into the body, which restricts the bleeding. In other cases, there can be a lot of blood loss. With an amputation, when a body part has been removed, such as a finger, a wrist or a leg, a very serious condition, depending on what has been affected. Sometimes there are only partial amputations. Make sure we keep the patient calm and we treat for shock and treat for serious bleeding. Tell the emergency medical services what has happened and wrap the severed part in cling film or a plastic bag. Then wrap it in gauze or soft fabric and place in a container of ice. Do not let the severed part touch the ice directly. Mark the container with the time of the accident and make sure you give it to the emergency medical services. Amputated parts should be placed in a plastic bag or wrapped with cling film before placing with ice, because ice will burn it and will destroy the tissue. A tourniquet completely stops all blood flow through and back, and these can cause a lot of problems, so these are not often used in first aid unless you know the correct procedure and it is a life-threatening bleed, a catastrophic bleed. Thank you for watching. I hope you really enjoyed the video, and if you did, please don't forget to like and subscribe to our channel, where you can receive lots more videos on really important and life-saving first aid skills. Thanks very much. Have a nice day.